tend to work. The idea of when you would, start to deal with some soft tissue changes. I wouldn't do what we just did and when somebody was in an acute phase of an injury. So these just make sense when we look at that. If there's an acute anything, just leave it alone. You can general, if it's a local acute thing like a knee sprain or something, you can just the general good old-fashioned massage will manage pain and support sleep. Those are the two most important things. If it's a local injury, just, you can maybe do a light touch with some lymphatic drain over it. Otherwise, just, it's doing what it needs to do. If it's systemic, like a fever, same thing applies. Just don't do massage that day. It's too much. And if it's something else, like they're just recovering from chemo, they've had a chemo session or something, you're not going to want to strain the adaptive capacity. When it gets into the subacute phase, that's when we can do some stuff. So it starts to add in. We still have the manage pain, support sleep, but now we could do some management of edema. We can do some fluid movement stuff. And we could start to manage compensation patterns. So as long as it didn't produce any pain, this would be something you could do that we just practiced, because this is usually gets out of whack with something that's a compensation pattern. Firing patterns fall into this as well. So this is a good week in. It's not something you're going to do right away with something. Certainly in the latter part of the subacute phase, it's time to manage compensation patterns. You may still avoid the actual injury area, especially if it was a more significant, like a grade 2 plus injury on a strain or a sprain. So we still got these: manage pain, support sleep, manage edema, manage compensation patterns, support rehabilitative activity. So supporting normal, and if it's significant enough and they are working with another professional, communication back and forth would be good. If there is scar tissue, if there's a sprain or a strain, even if it doesn't break the skin, there's still going to be fibrotic development. That's how stuff knits together. So we would want to start mobilizing the area and just start gentle, start moving things together and then apart, and then twist a little bit, and you can get more aggressive as time goes on. And then you can support tissue regeneration. And sometimes that is a specific, creating a very controlled inflammatory response in the area. So a little bit of friction in the area. But you're good 3 to 4 weeks in now on something. Usually, we get people when they've already remodeled it, and then we're trying to reverse some of that and find a more normal pattern for them. So we might be suggesting some rehab, some formal rehab. We might want to show the client how to do some cupping over some scar tissue if there's surface scar tissue. We certainly are going to want to restore and support firing patterns, gait reflexes, and general neuromuscular responses. We'll want to see if it's possible to eliminate some compensation patterns. will want to manage irreversible compensation patterns. They're productive, they're doing something. Fallon, when Fallon was walking and I saw her, she had her head down. Now, when she got done with all this messing around, her head was down and it was up. So she had been in a car accident years and years and years ago. So it could be that there's still some neck reflexes and eye reflexes from being shook around in the car accident. You'll see that when people want to look where they're walking. So over time, maybe you would see something improve along that. And you would work to restore tissue pliability, which doesn't happen by working in the grain. You got to work across it. So a lot of times with massage, you see a lot of this. Oops, their butt fell off. That you usually don't see. You see a lot of going from one joint to the other. You see a lot of that. Better is to go across it. Across the grain. Position it so that you can come and push that tissue away. Kneading. Although, try to avoid kneading because it's hard to do. If you can position it so that you can push it away and get that movement and that bend in there, that's easier on you. So side lying supports that a lot, being able to do that. So the same down here, instead of going with the grain, always going that way, coming across it. Okay, so when we get back from lunch, we'll dive into these firing patterns. Don't turn that off yet. I'll get to some pictures here. Okay, so just embedding how you can use your body mechanics here. You want to thoroughly work the foot, but that foot has got a ton of connective tissue, thick musculature. Don't wreck your fingers and hands on that. Use your forearm and do that as much as possible. This is side lying. Pay attention to side lying. You can get so much more done on the lower limb with the person in the side lying position. So this is showing me working with maybe a contract relax technique, but as soon as they're on the side, and this is the leg that's down on the table, the other one is on a square bolster over on the side, you can see how I can push that tissue away from the bone. Where if they were on their tummy, no matter what I'm doing, I'm smashing it against the bone. So there's, now remember that tissue, those muscles are a triangle. Looking something like this. So when I'm going straight up, I'm bending those fibers. And then here's the positioning for the top leg.